Good morning. So, in this scenario, I'm going to be simulating uh, replacing a disposable inner cannula and then providing care and cleaning for a tracheostomy site. So, represented here is my tracheostomy. This is the opening. The disposable inner cannula has already been removed, and this is the drain sponge, which is held with a rubber band. Now, before I get started with the patient, I would come and introduce myself. So, hi, my name is Ian Bruce. I would make sure to wash my hands and then identify the patient. So, now that they have identified themselves, I'm going to provide some privacy and explain that I'm going to replace their inner cannula and then also do some cleaning and care for the tracheostomy site. So, the patient has agreed to this. In this scenario, I know it's flat, but in reality, if this was a hospital bed, I would first have it raised up so I could have good body mechanics. And also, the head of the bed would be up to at least 30, if not 45 degrees, so that way we can help promote breathing for the patient, because if they're flat on the back, it makes it more difficult. So, I've removed the oxygen source and already removed the disposable inner cannula and thrown it away. So now I'm going to put on my gloves since I've already washed my hands. And this process is an aseptic technique, not a sterile technique, so it only has to be clean, it does not have to be sterile. And since the disposable inner cannula has already been removed, I would take out from a new package a disposable inner cannula and put it into the tracheostomy site. Alright, so now that the disposable inner cannula is in place and I see it's nice and secure, I'm going to now apply tracheostomy care. So first, we're going to remove the old soiled sponge and throw this away. Next, I'm going to take my normal saline solution, represented by this bottle of water, and pour it into my tracheostomy kit. And this will be used to clean around the tracheostomy site. Let's leave that uncapped. We'll now simulate changing gloves and putting on a new pair of gloves after washing my hands, since I used these gloves to take out the old inner cannula. Okay, so now that I have the normal saline solution in there, I'm going to take these cotton tipped applicators and dip them into the solution. And with the neck of the bottle representing the face plate that would be surrounding and protecting the stoma, I'll want to, in a circular motion, clean from the inner edge outward using each applicator. And now that I've cleaned this site, I'm going to take a dry gauze sponge and pat dry where it's wet, where I've cleaned. So now that the site is clean and the faceplate is already secure and has a new tie, that's something I didn't address earlier, is the tie that keeps the faceplate in there, I'm going to apply a new clean gauze sponge. And now that I have the gauze sponge securely in place, I can ask the patient if there's anything else they need, help making sure they're comfortable, and reapply the oxygen at this time as well. And just make sure they're comfortable before I then dispose my gloves and wash my hands again and document the care that I provided. And that's all for this video. Thank you for your time.